A Shaolin monk trains for hours without pain medication, without ice baths, without expensive recovery equipment, yet at 60, his body feels better than most people's at 30. No chronic pain, no joint issues, no constant soreness. And here's what's wild. He doesn't have special genetics or access to secret treatments. He just understands something about pain that modern fitness completely misses. Most people think pain is the body breaking down. The Shaolin understand pain as the body signaling adaptation. Learn to interpret that signal correctly, and pain becomes your guide instead of your enemy. By the end of this video, you'll understand exactly how Shaolin monks deal with pain and why their approach works better than anything modern medicine offers for training-related discomfort. Let's talk about why modern pain management fails. The first mistake is treating all pain the same. Acute injury pain and training adaptation soreness feel similar but require completely different responses. Acute pain means stop, ice, get professional help. Adaptation soreness means continue and manage it intelligently. Most people treat adaptation soreness like injury. They ice it, stop training, prevent the adaptation that soreness signals. The Shaolin distinguish between these two completely different pain types. Injury pain stops training. Adaptation pain signals progress and requires intelligent management. Then there's the pain avoidance approach. Do anything to eliminate pain. Take medication, use ice, use heat, use compression. Do whatever numbs the pain away. The theory is pain elimination equals healing. The reality is pain elimination often prevents healing. Soreness signals your body to adapt. Eliminate soreness and you eliminate the signal for adaptation. You never build resilience to that stimulus. The Shaolin sat with soreness, understood it, managed it without eliminating it. The complete rest approach is another common mistake. Feel pain? Stop training completely. Rest for weeks. The theory is complete rest allows healing. The reality is complete rest often creates weakness and deconditioning. Light continued training actually speeds recovery by maintaining blood flow and preventing muscle atrophy. The Shaolin never completely stopped. They modified training, reduced intensity, continued movement. The pain medication approach is another failure. Take ibuprofen or other pain relievers to mask pain and train through it. The theory is pain medication allows training continuation. The reality is pain medication masks the signal your body sends. You can't tell if you're making injury worse. You end up with worse damage because you couldn't feel the worsening. The Shaolin never mask pain. They listen to it. And finally, there's the ignoring prevention approach. Train hard, accept pain, never work on prevention or resilience. The theory is pain is just part of training. The reality is most training pain is preventable through intelligent programming. The Shaolin prevented most pain through smart training that built resilience progressively. Every conventional approach to pain management fails because it either prevents the adaptation signal or masks pain so you don't hear what your body is saying. The Shaolin approach listens to pain, interprets it correctly, and responds intelligently. Here's what the Shaolin understood about pain. Pain is information. Acute stabbing pain means stop immediately. That's injury. Dull, aching soreness that improves with movement means adaptation. That's progress. Burning sensation during movement means your nervous system and muscles are working hard. That's training stimulus. Sharp pain on specific movement means alignment issue. That's technical feedback. The Shaolin learned to interpret these different pain signals and respond appropriately to each. When adaptation soreness appears, the Shaolin response is intelligent management, not elimination. They reduce intensity slightly. They continue training. They use specific techniques to accelerate adaptation. The goal is to move through soreness, not around it. This teaches the nervous system that discomfort doesn't mean stop. It means adapt. Over time, the body becomes more resilient. Pain sensitivity decreases. The same training stimulus that created soreness initially creates none after adaptation. Here's the first pain management practice: the contrast shower. After training, alternate between hot water and cold water. Hot for 2 minutes, cold for 1 minute. Repeat 5 to 10 times. End with cold. This technique improves blood flow. It accelerates recovery without numbing the pain signal like ice does alone. The hot water increases circulation. The cold water reduces inflammation. The alternation stimulates adaptation. Your body learns to handle temperature extremes. Your resilience improves. Soreness decreases faster through this intelligent contrast approach than through ice or heat alone. The second practice is gentle movement during soreness. Don't stop training. Reduce intensity and volume significantly, but continue moving. Walk. Perform light mobility work. Do the exact movements that are sore, but at minimal intensity. This maintains blood flow. This prevents deconditioning. This teaches your nervous system that soreness doesn't mean danger. Most people stop completely. The Shaolin moved gently through soreness. Adaptation happened faster. The third practice is breathing into pain. When soreness is worse during training, don't tense up. Breathe into it. Deep, diaphragmatic breathing. Your nervous system interprets panic breathing as danger. Your body tightens. Soreness feels worse. But if you breathe calmly, your nervous system stays regulated. Your body stays relaxed. Soreness feels manageable. This simple technique changes pain perception dramatically. The pain signal doesn't change, but your interpretation of it changes. You become resilient to it. The fourth practice is ice contrast for specific injuries. For true acute injuries, not training soreness, the Shaolin used ice, but only briefly and never alone. Ice for 5 minutes to reduce acute swelling, then contrast therapy, then movement. Never prolonged icing that prevents adaptation. The goal wasn't to eliminate pain. The goal was to manage swelling enough to continue intelligent training. That continued training accelerated actual healing. The fifth practice is sleep and nutrition prioritization. Most recovery happens during sleep. Most adaptation happens when muscles receive adequate protein. The Shaolin made these two factors mandatory. 8 to 9 hours every night. Adequate protein every meal. No shortcuts. Sleep and nutrition are where pain management actually happens. Everything else is just management during training. The sixth practice is distinguishing adaptation soreness from injury immediately. The first time soreness appears, assess it. Does it hurt on one specific movement or many movements? If specific movement only, likely technique issue. Fix the technique. If multiple movements, likely adaptation soreness. Continue training at reduced intensity. Does pain improve within 2 to 3 days of reduced training, or does it worsen? Improvement means adaptation. Worsening means possible injury. Seek professional help. The Shaolin made these distinctions immediately. They didn't guess, they assessed. Here's how the Shaolin handled chronic pain that develops over time. The goal was always to reverse it, not to accept it or manage it indefinitely. They would deload training completely for 1 week, reduced volume by 50%, maintained intensity, then gradually reintroduce full volume over 2 to 3 weeks. This deload week often resolved chronic pain that had been building. The body caught up on recovery, adaptation completed, pain disappeared. Most people never deload. They train through pain indefinitely. The Shaolin deloaded strategically and resolved pain. Track your pain patterns. When does pain appear? After which movements? After high volume? The Shaolin understood that pain patterns reveal training problems. Pain appearing at higher volume means volume needs to increase more gradually. Pain appearing after certain movements means technique needs improvement. Pain appearing consistently means you need deload. Track these patterns. Respond intelligently. Here's what I want you to understand. Pain after training is information, not punishment. Listen to it. Interpret it correctly. Most pain is adaptation soreness that requires intelligent management, not elimination. Continue training at reduced intensity. Use contrast therapy. Use breathing. Use sleep and nutrition. Use deload weeks when needed. Your body will adapt. Pain will decrease. You'll become more resilient. Never mask pain with medication and train hard. That creates injury. Never stop training completely. That creates deconditioning. Never ice aggressively. That prevents adaptation. Instead, listen to pain, interpret it, respond intelligently. Your body will tell you exactly what it needs if you learn to listen. If you're committing to understanding pain like Shaolin monks, drop a comment saying, "Pain awareness," and let me build a community of people who understand that pain is information and that intelligent pain management beats pain elimination. And if you want detailed guidance on distinguishing injury from soreness, how to modify training for specific pain patterns, or how to design deload weeks, hit subscribe and turn on notifications because we're building the most complete pain management training community on the internet. People who listen to their bodies instead of fighting them. The Shaolin monks discovered that pain is information, not punishment. Acute pain means stop. Adaptation soreness means continue and manage. Contrast therapy accelerates recovery. Gentle movement through soreness builds resilience. Breathing into pain regulates nervous system. Ice briefly for swelling, never prolonged. Sleep and nutrition are where real recovery happens. Deload weeks resolve chronic pain. That's the entire system. That's all you need. The decision is simple. Fight pain and create injury, or listen to pain and build resilience. The commitment is sustainable. Intelligent training modification when needed. That's it. The results are inevitable. From constant training pain to intelligent adaptation. From chronic pain to pain-free training. From fighting your body to listening to it. Now perform your first contrast shower. Begin intelligent pain management, and I'll see you in the next video.